Now let's get into the self-concept of student or trainee versus the self-concept of attending or expert or authority. Because when you go from trainee, when you go from resident or fellow to attending, your self-concept has to shift. It has to elevate. This is a classic death and rebirth situation where an old version of you is going to die, student version of you has to die, an expert, authority, attending version of you must be born. And if you can do this, if you can elevate your self-concept seamlessly, you are going to make your life so much easier. A lot of us get stuck in student mindset, okay? We get stuck in perfectionism. We get stuck in people pleasing, in trying to look outside of ourselves to make sure we're doing the right thing, which is what we did as residents, as trainees. But as an attending, the buck stops with you. You're it. And so you have to get to a place where you trust yourself, where you know yourself really, really well, so that you can do the best thing for the patient and the best thing for you. And that's how you have a sustainable career. If you're stuck in student mindset and you are an attending surgeon, that does not create a sustainable career, okay? Because you're gonna say yes to everything. You're gonna always be looking around for the other shoe to drop, and you're gonna be thinking that as soon as you make a mistake, someone's gonna point you out and kick you out, and that you're like one mistake away or one complication away from losing everything. All right, that is not sustainable. That is a very shaky self-concept. We want to get you nice, solid ground so that you can have a sustainable career. Okay, and it starts, like I said, all roads go to self-concept. So let's just review the self-concept of trainee versus attending. So as a trainee, you are showing up in service to the patient, okay? You're thinking, what does this patient need? I want to take care of this patient. What do I need to do? And you're drawing from all of the knowledge that you had from medical school and the experience you had as a trainee, and you're coming up with ideas for plans, and then you're staffing it with an attending, and then they might be tweaking it, or the attending might be saying, hey, that's a great plan, let's do that, okay? And so you're developing a skill of how to take care of patients by trying to figure out what you need to do in service to that patient. And then in the operating room, you're learning skills in service to the patient. You're trying to emulate what your attending is doing. They're slowly but surely, see one, do one, teach one. They're showing you how to get the reps, how to do the surgery until as a fourth year, as a fifth year, as a chief, now you're getting your feet wet, doing it on your own and mentoring younger trainees, right? So you're starting in service to the patient, in service to the team, obviously, because you're having to take care of your attending, you're having to take care of the other team members, your co-residents, and it really is kind of like a container, a bubble, a team effort that you sign up for. And it's a very small world for you because it's like you don't really get the same kind of experience. You don't get to see what coding is like. You don't get to see the revenue cycle. You don't really have any knowledge, at least I didn't. Maybe they teach this now in residency, probably not though. You don't really know what's happening in like the politics of healthcare or the economics of healthcare, right? We don't focus on that. We're just trying to survive, keep our team happy, and we're trying to take care of our patients. And our sense of self is detached from outcomes because we are not going to look at a patient who has something go wrong. Let's say a patient who has a complication that might be not our fault whatsoever. They just have post-op bleeding, or they have a post-op infection and we have to drain pus. We're not going to make that mean anything about us. We're just going to do it. Similarly, we may not make other people's complications. Let's say a patient comes in from an outside hospital, some other surgeon operated on them, and they have a complication. Our brain may not go to judging that other surgeon. We might just be like, oh, that we just need to take care of this. Sometimes we do, who knows, but we are not going to attach our self-concept, our self-worth to that patient's outcome because we are just learning. We are on a team. We're trying to help people. We're trying to learn skills. We're trying to gain knowledge. We don't have any sort of repercussion if something doesn't go well. We won't get a board investigation. If we get named in a lawsuit, we're not going to be liable because our attending is the one who is a liable one. And we aren't going to attach our self-worth to the patient outcomes. We're just going to do our best. So we don't even have a sense. I didn't have a sense of what this meant when I was a trainee. I didn't realize it until I became an attending. And so I want all of you to understand that when you attach your sense of self to the outcome, it creates a problem. And we'll get into that. So this was actually a good thing as a trainee, right? You're striving, another good thing. As a striving, serving species, we're always wanting to be striving, future focused, and we're in this little bubble as a trainee, just striving and striving for this end game, this end point of becoming an attending surgeon. And we have our eye on the prize of getting board certified, of making it to fellowship, of getting that first job, whatever it is. We are looking to the future and we're striving for that thing, and it feels amazing. Our world is small. We're in this little bubble of residency. We're in a container that lasts 5 years. We know when it starts. We know what first year, second year, third year, fourth year, and fifth year are going to look like. We have the map laid out for us. We signed up for it. It's hard. It can be toxic, but we know what we're getting into. And we revere our mentors' ideas. That should probably be a S apostrophe, not just one mentor. You probably revere multiple mentors' ideas, right? And their skills. We're watching them and we're like, oh my God, that's amazing. Like, I remember there was a head and neck attending at MD Anderson who would essentially do a neck dissection with like his thumb. I think it was Dr. Diaz. He would just come in and like, and all of a sudden, like the specimen was out. And I was like, what just happened? You know, like we're watching our attendings and they make everything look so easy. And they come up with plans like this. You know, it's like they draw from so much knowledge and so much intuition, and they can figure things out so quickly. And we're like, oh my God, you know, we revere that. Okay, so this is the student mindset as a trainee. As an attending, now you're gonna have to show up in service to the patient, of course, first. And you're wanting to show up in service to yourself second. You don't want to forget about yourself. And you want to put yourself second because you matter, okay? This means saying no. This means having boundaries. This means protecting your time. This means protecting your needs to sleep, eat, rest, and play. And when you do that, then you create a sustainable career, okay? So you want to take care of the patient, but you also want to take care of yourself. And your self-worth may get attached to outcomes. You have to notice if that happens. Not all of us create that, but a lot of us do, where especially if we're in imposter syndrome, or we have a lot of anxiety or a lot of fear or a lot of uncertainty or self-doubt, we're going to tell ourselves a story that as long as I have 100% perfect surgical outcomes, I will be okay. But as soon as something goes wrong, as soon as a patient is unhappy with me, or I make a mistake, or there's a surgical complication, whether or not it's within my control or not, I'm going to make that mean that there's something wrong with me. And the problem with that is that something will go wrong. Patients have complications. Every single surgeon has complications. We know this. If you're not having surgical complications, you're not operating enough. It's an inevitability. And so attaching your self-worth to a surgical complication is just going to cause you unnecessary suffering. And so it's very important to learn how to strategically detach that. And we'll get into that in a minute. You might end up stagnating, or you might go back to striving and serving. A lot of surgeons end up stagnating. They get to the promised land, they close the loop on their surgical careers, and then they're like, okay, well now what? I just do this until I retire. If you're in private practice, you're like, well, okay, I guess this is what I do. This is my life now. And then maybe you try to buffer, meaning you try to make yourself feel better with like overeating or overdrinking or going on lavish vacations or spending lots of money shopping, scrolling on Instagram, anything to kind of like scratch that itch of that dopamine release, because you're not getting it from that future focus, from that striving. And so you can end up stagnating. A lot of us, you know, if you go into academics, maybe you'll start striving to climb the academic ladder, and maybe that'll scratch the itch for a while. But ultimately, if you can pay attention to how much you need to strive, and if you are a striver, if you are absolutely someone who must always be future focused, to find the next thing. And it doesn't have to be within surgery or medicine, it can be outside of it. That's where diversifying your identity comes into play. If you can find another way to serve others and to give value, then you can strive for something different. It doesn't have to be in medicine, okay? So we'll talk about diversification of identity as well in future classrooms. And your world can either expand or it can contract. Your world will expand if you understand these concepts and you know, you have a language. You're like, okay, this makes sense. I've reached the promised land here. I need to open another loop. Okay, that will expand your world. If you're not attaching your self-worth to outcomes, that will expand your world. If you have a really ironclad, solid self-concept, that will expand your world. Your world will get small if you are looking at complications and you're attaching your self-worth to them, and then you have anxiety or PTSD and you stop doing certain surgeries because they cause you too much emotional distress, or you harass yourself every OR day and you're anxious and you're always trying to control circumstances outside of your control, and you're just this ball of anxiety who is trying to overwork and do things that you're spending all of this mental energy on things that you shouldn't be spending your mental energy on. And then you maybe stop doing certain surgeries, and then maybe you stop operating completely and you're just seeing patients in clinic. And then you're like, well, what do I do now? Like, is this what I'm going to do? I'm going to be a non-surgical otolaryngologist, as an example. I have some clients who go this way, and now you're like, okay, well, now my world is really small. Is this really what I'm going to do until retirement? That's your world contracting. If you let complications or derail you, if you let certain things that happen derail you, and then you stop doing certain surgeries, or they become too scary because there's too much at stake. Like for me, I stopped doing head and neck. I did a lot of head and neck when I first came out of training. The first 2 years I did thyroids, I did parotids, I did big head and neck cancers, and then I just stopped doing it. Once I got into private practice, I was doing some of that. I was doing some parotids here and there, and I was like, you know what? I just don't feel like I want to be operating on the facial nerve. I don't want to put someone's facial movement at risk. And so I'm just not going to do it. And I found a lot of joy in just doing sinus surgery. And so that's how I kind of niched down. And so when your world contracts and niches down like that, it doesn't have to be a bad thing. I just want you to pay attention that if your world is getting smaller, why that is, first of all, is it because you don't like doing certain surgeries or you're afraid of them? Always pay attention to that. You're having fear or anxiety around them. And if you really desire doing them and you're missing doing them, considering working through that anxiety or getting some help, getting a coach, getting a mentor to get you back in the operating room to do those specific surgeries that you really enjoy doing. Or if your world does contract and you really niche down in your specialty or your subspecialty, to understand that you can expand it in other ways. And you do that by diversifying your identity. And you want to learn how to revere your own ideas, okay? If you can learn how to revere your own ideas, that's again how your world gets bigger and how we innovate and we come up with creative solutions. Or a lot of times if we start stagnating and we're getting the muscle memory and we know how to do this, like for me, I can do septoplasties in my sleep, I can do sinus surgery in my sleep. It almost gets to the point of like boredom. And I have a lot of clients who tell me this, where it's just like, yeah, I just show up and I do surgery. It's not hard, I can just do it. And so you can get to the point of boredom, and you want to pay attention if you get there. That just means that you've reached the promised land and you're a striving, serving human who needs to open up a new loop, right? Or you can end up with a really small world of self-doubt where you're just an anxious ball of I don't know what I'm doing. I'm always looking towards other people to tell me I'm doing the right thing. This is probably someone who gets stuck in student mindset, where you're never trusting your own judgment. You're not trusting your own ideas. You're not trusting your own assessment or plan or anything that you decide for a patient. You're always second guessing, and you're looking outside of you. You're looking for some mentor from training. You're always thinking of like a committee of mentors from training, and they're judging your decisions. That is being stuck in student mindset, and that will also keep your world really small. Let's get into perfectionism. So the definition of perfectionism is refusal to accept any standard short of perfect. A lot of us are perfectionists, right? And perfectionism is basically just fear and shame. Shame is also fear, okay? Shame is the fear of making a mistake and then being deemed unworthy of love and belonging. And so when we have fear and we have shame, shame is such a powerful social motivator. We will avoid doing things that are not perfect, okay? We will not take action unless we know we can execute perfectly. And the important thing about this that I want you to take home from perfectionism is that it's not in service to patients. When we are in perfectionism, it's not about the patient anymore, okay? It is about us. We are out of service, almost like the phone line is out of service, right? We are out of service to the patient. We are in service to our own ego. Our ego's desire to remain on that perfect pedestal, to remain special. We don't want to do something and fail and then get knocked off that pedestal of being the perfect surgeon, of being the one who does everything perfectly, who never makes a mistake. As soon as we make a mistake, as soon as we fail, we get knocked off that pedestal, and then it's almost like a complete loss of identity. So we're holding on to that identity of the perfect surgeon, of getting the A+, of doing everything perfectly, of never failing. We're holding on to that with like a white knuckle grip. And if we do something that tells us that's no longer true, that challenges that identity, then we are going to feel like we've completely lost our identity. And so that's why it's so important to understand where perfectionism comes from, and understand that it's not for anyone else. It's not for people. We might tell ourselves a story, oh, I'm a perfectionist, so I only do surgery perfectly, or I only do things perfectly for other people. It's not for other people. It's for us. It's for our ego. When we are in perfectionism, we are not in service to others. We are in service to ourselves. And it's not even about what we think of us. It's 100% about what other people think of us. And so we're imagining how other people are perceiving our failures. So we're not willing to fail for fear of being knocked off our pedestal of perfect. And we're not even thinking about what we think of the failure. We're thinking about what other people are going to think about our failure. So we are not even in our own business. We're in other people's business, right? In their minds, imagining what they are going to think, what they're going to say about us if we fail, when we fail. It's such a mind fuck, right? And it keeps us stuck doing only the things we know really well. So we're never gonna go outside of our comfort zone. We're gonna stay right within our comfort zone. And so that means we don't grow, we don't evolve. If we want to become successful, we have to learn how to fail. And in surgery, we're going to fail because mistakes will be made, patients will have complications. And so if we're in this profession where failure is inevitable, mistakes are inevitable, complications are inevitable, you can see how showing up in perfectionism is not useful. It's not in service to the patient, first of all. It's only to our ego. It doesn't help anything if we are in the spiral of doom and gloom and having shame and wanting to hide and crawl into a hole and die because something bad happened. How are we supposed to manage that complication or manage that mistake when we are making it all about us, right? And so these are there's three main types of attachment that we can have. And if you are the overly attached surgeon, these are my little stick figure surgeons with their little bouffants. This is the perfectionist, right? The overly attached surgeon, where you are holding on to that outcome and you're just like, please be perfect. Please never have a complication. And even though we can't control all of the germs in the world, we can't control all of the patient factors, they're completely not within our control. We're just hoping and praying that if we do everything perfectly, that the world will show up for us and our patients will have perfect surgical outcomes. And we don't ever want that ball to drop, because that would mean there's something wrong with us and we would go into a shame spiral, and that would be awful and feel horrible. And we don't want to feel that feeling state, okay? So we hold on to that surgical outcome with just this, white knuckle grip, right? So that's the perfectionist surgeon. Then we have the completely detached surgeon, okay? And so this is someone who's like, I'll show up, I'll do it. Either you have a good outcome or you don't, doesn't matter to me. This could also be the surgeon who has a narcissistic personality, who has decided they are perfect, and they've decided that if anything happens that could challenge that identity, they will sweep it under the rug, they'll deny it, they will shift the narrative, they'll spin the story to make sure it fits with that perfect surgeon identity, okay? So you may have known surgeons like this. A lot of these surgeons end up going all the way to the top. They become program directors, they become chairs of departments, and they can do no wrong in their own eyes, and they keep that identity really nice and secure, and they never get knocked off their pedestal because they don't allow it. They will lie, they will blame, they will make things up, sweep things under the rug to make sure that that identity stays secure and they stay on their pedestal, right? We've all known these surgeons. Or this could also be the surgeon who's completely burnt out and depersonalizing, and they just don't have the capacity to care anymore. So this could be someone who did care once, who was here and got so burnt out that now they're just completely detached. And that is a scary place to be, all right? I don't want you to go from here to here. This is not a good place to go. This is not a good way to be taking care of patients, right? We want to care. We don't want to just show up and be careless. What we want to do is be strategically detached. And that's kind of this middle ground where we have one hand on the outcome and we're like, listen, I care. I want to create the perfect surgical outcome for every patient, but I know there's only certain things in my control. I can show up and try to execute excellently every single time. I can show up in service to the patient and not to myself. I can put my perfectionism to the side and just do the job to the best of my ability. And I can also understand that when bad things happen, when patients get infections and things bleed, and things don't heal exactly the way I expected them to, and patient factors come in, the patient has a PE or a patient has some sort of event after surgery, I don't make that mean anything about me. And I can evaluate it and think, what could I have done differently to have prevented that? And so that brings us to the concept of dualism, where you have two contradictory things existing in your brain at the same time that create a cognitive dissonance, but they exist together. And this is how you show up. Is showing up with dualism is how you show up as the strategically detached surgeon who shows up in service to the patient and tries to create the most perfect outcomes whenever possible, understanding that that's an impossibility. That is the empowered human strategically detached surgeon, okay? Very different than the imperfectly perfect surgeon, okay? Or the impossibly perfect surgeon, excuse me. That does not exist. We cannot be the impossibly perfect surgeon. If you are the impossibly perfect surgeon, then you are detached from the outcome, or you're overly attached and your self-concept is gonna go right into the crapper as soon as a patient has a complication. And so the empowered strategically detached surgeon is thinking two very contradictory thoughts, and he holds these two truths at the same time. This is dualism. They think that I'm gonna show up with the goal, okay? My goal is to give every single patient 100% perfect results every single time. That is my goal. In my mind, that's what I endeavor to do. And they're gonna think, I know it's impossible for me to create 100% perfect results for every single patient. These are two very contradictory thoughts, but the reason why we wanna show up with this intention is because it helps us show up as the highest version of ourselves, and it allows us to execute excellently. But we also want to have this thought, okay? Because when things do go wrong, when patients do have complications, when we make mistakes, we can remember that is part of the deal. That is part of the human experience. It's part of being a human being. We are fallible creatures. We make mistakes. We err. It's going to happen. And then if we have that, we don't have to go down into that shame spiral and shrink our headspace. We can stay present and just show up in service to the patient. Okay, something happened, a complication happened. What do I have to do next? And then we take care of the patient, and then we take care of ourselves in the aftermath. We can review it, we can look at it, what went well, what didn't go well, what would I do differently, extract value, what can I learn from this, apply it to the next time, and then we can grow and evolve on top of our failures. That's how we take mistakes, failures, and complications, and we evolve from them. We grow with them instead of putting them in some sort of shame vault inside of ourselves and never talking about it. And having self-compassion is really important when things go bad. And so you're going to want to look how you talk to yourself. You're going to want to pay attention to how you talk to yourself and talk to yourself kindly whenever things go wrong. You're also going to want to connect with other surgeons who have been there so that you can normalize that experience, the experience of having complications. And then you're gonna want to go back into your dualism to understand, like, I have the intention, my intention is to always give patients perfect results. And I know I'm a human and I can't do that. I have those two very contradictory truths, those two very contradictory thoughts in my head, always at the same time, existing with that cognitive dissonance when I show up to the operating room. Now, perfectionist culture in surgery, this is very interesting, tells us it's not about doing good surgery, right? It's about not doing bad surgery. When we are perfectionists in surgery, we don't pay attention to our successes. Nobody points out our successes, right? Something happens, we do 100% perfect surgery, the patient has a great outcome, they're like, you're the best, you're amazing. Our brain forgets about it. Nobody gives us an award. We don't get a gold medal every single time a patient has a good outcome, okay? But when something goes bad, it's like it's like a 5-alarm fire, right? So it's not about doing good surgery in perfectionist surgery culture. It's about it's about not doing bad surgery, about never doing bad surgery. That is what being a perfectionist is in surgery. And I want you to understand where that comes from. And it comes from prospect theory, which was coined by the Nobel Prize winning psychologist, Dr. Daniel Kahneman and Dr. Amos Tversky. They came up with this prospect theory based on their research, which basically says that humans will have a bigger emotional reaction to a loss of something than they will to the gain of that very same thing. Okay? And so for us, complications, the loss of something, a perfect surgical outcome, is going to hurt a lot more than a perfect surgical outcome, than a success. Complications create a bigger emotional reaction than successes. And this makes sense evolutionarily, because if you think back to ancient humans, let's say you were hunting and gathering and getting your food ready for winter, and you have this food stash. Okay, you did all this work to get this food stash, now you have it, and somebody steals it, you lose it. That could mean starvation, that could mean death. And so it's gonna hurt a lot more. You're gonna have a much bigger emotional reaction to the loss of that food stash than you are going to have an emotional reaction to actually gaining that food stash, okay? So why do we care about having perfect surgical outcomes? Why do we care about being perfectionists? That one surgeon maybe you remember from training, let's say we all had one of those who was in our academic institution who could do no wrong, who was up on the pedestal, the institution revered them, they maybe were misogynistic or racist or who knows, maybe they treated people really horribly, they were just potentially, they position themselves as really good people, but maybe you had some questions about maybe they're not that great of a human. And they're up there and they're like the professor or the chair or the program director or whatever they are, and they can do no wrong in their mind. They have this perfect identity. And, why? Why did they get there? Why does it matter? Why do they care? Why would you want to go there, right? The reason is social positioning. So we want to be at a higher social position, at power, status, and wealth. We want to sit up there with power, status, and wealth above all of the other humans. And that is probably what's happening in the mind of that extremely perfectionistic, narcissistic surgeon that you may have known in training. And so that's just a normal human thing, right? Some people just take it to a little bit higher degree than others. But I want you to understand why that's so important and pay attention to that in your own brain, how you want to have a higher social position than other people. We tell ourselves a story that success means getting to the highest social position, that a happy life is having the highest social position. That's why, we want to aspire to the presidency, right? The leader of the free world, right? That's the highest social position. So if you read the book From Strength to Strength by Arthur C. Brooks, he talks about these formulas. One is for satisfaction. Satisfaction, he says, the way that we think about it, is continually getting what we want, right? We're satisfied if we're always getting what we want. And so our brain is always going to look for checking to make sure we do that. Okay, we're always getting good surgical outcomes. And it's going to ask you, I'm afraid of not getting what I want. So let me make sure that I make every single patient happy. Let me make sure that I have the most perfect surgical outcomes. And if something goes wrong, if a patient complains or somebody has a complication, I am no longer satisfied. And success is satisfaction or continuously getting what we want and having more than others. And so we might also look at other people, maybe look at our colleagues if we're in private practice, look at their schedule. Oh, are they seeing more patients? Who's seeing what? Why do I only have this many patients? They have that many patients. They're going to generate more revenue than me. Like, we're always comparing ourselves to try to keep up with the Joneses. That's what our brain tells us is success, getting what we want and having more than other people, right? Not a good equation to solve for. And then that means failure is having less. And so if we look and we have less than our partners, if we're in private practice and they make more than us, or they see more patients, or they do more procedures, or the staff keeps giving them the good cases or the good like patient visits, the good patients with the good insurances or whatever it is, if we're looking at that and we're always comparing and despairing and saying like, that partner has more than me, our brain is going to continuously focus on that. And it takes you to, or it's a road to nowhere, basically. This is not the right math to solve for, okay? According to Arthur C. Brooks, and I completely agree with him, and you could probably see why it can make you crazy, right? Instead, the better math to solve for is the math of satisfaction. This is Arthur C. Brooks' equation. Satisfaction equals what you do have over what you want. So we're always looking at what we want, okay? We're looking at the denominator, and we're not looking at what we have. We have to really look at the numerator. We want to check with what we have and make sure that what we have, if what we have is more than what we want, we will be satisfied. This is essentially loving everything you have. This is different than gratitude. This is like loving your house, loving all of your possessions, looking in your closet and looking at all your clothes and just loving every single thing that you own. And if you don't love it, just getting rid of it, right? This is kind of like, what is that? Marie Kondo, right? Where if you don't love it, you can thank it and then throw it away. It's doing that for your life. You look around, you're like, God, I love my spouse, I love my kids, I love my life, I love my house, I love my job, I love my patients. You're looking at everything that you have, always taking inventory, taking stock of what you have, and then looking at what you want and trying to always solve for what you have, making sure what you have is more than what you want. And if you do that, you're gonna always be satisfied, okay? So if you live in $1 million house and you want a $10 million house, you're not going to be satisfied. But if you live in $1 million house and you want $1 million house, you're going to be satisfied, right? Success is not having more than other people. It is actually a joyful effort, creating something of value that serves others. And again, this goes back to us being a striving, serving species. If we are always striving, that's the joyful effort for something that is meaningful to us, and we're creating something of value that serves others, that's serving, that is success. That is having a positive impact. That is why we became surgeons in the first place. It's what we have to really go back down to. This is essentially knowing your why. Simon Sinek talks about this, where we have the what we do, how we do it, and then why we do it, right? So we can say what we do. If somebody asks us, what do? You can say, I'm a surgeon. And then they can say, like, well, what does that mean? You can tell them how you do that. You say, like, well, I take out gallbladders, or I fix hernias, or I open sinuses. I tell people I'm a plumber. I fix septums. I get noses breathing. Whatever it is, how you do it, you can give them some idea of how you do that. But if they say, hey, why do you do that? Why are you taking out gallbladders? Like, why are you fixing hernias? Why are you making noses breathe? Why do you care? Why are you opening up sinuses? That is a harder question to answer. And if you can answer that question, that is how you get down to your self-concept, okay? So I'll leave that with you to think about that. Why are you doing what you do, okay? You want to make sure that whatever you're doing, why you're doing it, is because of a joyful effort to create something that serves others, okay? Something of value that serves others. And then we can reframe failure. Instead of it meaning having less than others, it's actually just information about what might not be working. So if something happens with surgery, if a patient has a surgical complication and it's a surgeon-specific complication, we didn't do something well, either we did the wrong move or we did the right move and we did it incorrectly, and that led to a bad outcome or a less than ideal outcome for the patient, that's when we have to look at what went well, what didn't go well, what would we do differently? That's extracting value, it's getting information, it's looking at evaluating everything we did, every move we made, looking back and seeing where maybe something went wrong. Either we did the wrong move or we did the right move and did it incorrectly, and then correcting for that, fixing that the next time. You know, if the patient has a less than ideal surgical outcome, if we can repair it, we do it, or if we have to send them somewhere else to get it repaired, we do that. Whatever we need to do to serve the patient in the aftermath of that, and then extracting value and applying that to next time so that we don't let it happen again. So it could be information about what might not be working. Not always, you know, some patients will just have a complication because they get an infection and there's nothing we could have done. That doesn't mean that something wasn't working. So we have to evaluate it to see, is there information here about what might not be working? If a patient has a post-op bleed because they have really high blood pressure and they're on blood thinners or whatever it is, maybe the information is we have to make sure we're like really aggressive about getting their blood pressure better controlled before we take them to the operating room, or whatever it is. We may not get information about what might not be working. We may not be able to change anything, but we have to evaluate it from a place of not attaching our self-worth to the outcome in order to extract that value. If our self-worth is attached to the outcome, we're not going to be able to extract that value and apply it, and then we're not going to be able to grow and evolve, and our worlds are going to stay small. And so this is better math. Satisfaction, always looking at what you have, making sure it is more than what you want, then you'll always be satisfied. Finding your big why. What is the effort that gives you joy, that creates value, that serves other people? And then extracting information whenever you have a failure, looking, hey, what might not be working here? Let me extract the value from this. This could be information that could help me grow and evolve. Let me not make this mean anything about me specifically. If you do that math, that is how you create a happy life, okay? And a sustainable career in surgery.